Sonia Roldan Muñoz, and I work in Prominent Project 3.2, incorporating patient preferences into regulatory decisions for anti-diabetic drugs. First of all, I would like to explain why patient preferences are important, and I will describe two main scenarios. Firstly, at the time of prescription. They are relevant because they might increase treatment satisfaction. With it, we will increase adherence, and we will have therefore better treatment outcomes. But they are also relevant at the time of approval, and this is because they help assessing the benefit-risk balance of drugs, also because we want to know whether there are differences between regulators and patient preferences, and also because we want to test whether there are differences in the acceptability of drugs across countries. But how do we answer these questions? We mainly use cross-sectional multi-country surveys. The first project included pregnant women from different countries in Europe. These women had chronic diseases, among them diabetes, and we asked them to complete the beliefs about medication questionnaire. In this questionnaire, we can test whether you have positive or negative beliefs towards medication, and we saw that those women have negative beliefs are related to a lower use of medication during their pregnancy. We could use this as a proxy to detect those women who might not be adherent to their medication, and we could therefore have a better use of medication during their pregnancy. In the second project, we tested patient preferences towards anti-diabetic drugs in the Netherlands and in Turkey. We included patients from both countries, and we defined the drug by 6 effects. What we saw is that patients in the Netherlands were mainly focused on gastrointestinal side effects and hypoglycemic events per month, while Turkish patients were mainly driven by the effect of the drug on cardiovascular diseases. We could conclude, therefore, that at least between these two countries there are differences in the acceptability of drugs, and they might be used differently. We should therefore acknowledge this at the time of approval of drugs. Finally, I will present the third project. This has been just started, and we want to know which aspect might influence regulators in the communication of safety information for SGLT2 inhibitors, a drug for diabetes. What we know is that safety information is communicated at different times in different regions, and we want to explore why this is happening. However, this project is just started, and I will only be able to show the conclusions in the final Prominent Symposium. Thank you for your attention, and if you have questions, please type them in the chat or email me anytime. Thanks!